Hello and welcome everyone. We're all here because we care about the well-being of children, whether it's in the home or in the classroom. And I think especially with the pandemic, we're seeing mental health as more and more of kind of a pressing issue. It's very important. It was a pressing issue before, but it's really in our face now. Um, and so it's important to talk about it, but mental health is a complicated topic that I could spend a really long time discussing. So tonight, I'm really only going to be covering the high points, but we'll have plenty of time afterwards if you want to stay on and chat with me. If you want to call me, I can do that too. Um, but you're welcome to put your comments and questions in the chat as well. I'll be keeping an eye on those, and I'll be sure to get everyone my contact info if you'd rather discuss some stuff with me privately. So, this is one of my favorite mental health quotes. Abraham Maslow, he's well known in the mental health field because he created Maslow's hierarchy of needs, which is basically the theory that people need their basic needs filled first: food, water, warmth, rest, safety. And I think that's a lot of where we want to focus first, especially in schools. They want to make sure kids are fed, they want to make sure they feel safe. And as parents, you want to do that too. Um, and hopefully, we're already doing those things. But once we meet their needs for safety, warmth, water, food, and rest, then the next step is sort of filling their other mental health needs, like their need, a child's need for belonging. Um, and basically, what I believe this quote is saying is that for our mental health to thrive, we can't just maintain the status quo. It's something we have to keep working on, even in moments where everything feels okay. We don't want our mental health, we don't want our children's mental health to just be okay. We want everyone to thrive. And to do this means addressing mental health before there's a problem and working on it when it's a problem too. And so, my goal for today is to give you the information and tools you need to be able to identify when you have a child that's struggling and then how to help. So, basically, we'll be talking about some statistics, some things that can protect or put your child at risk. For mental health struggles, and signs and symptoms that could mean they are struggling, and basically what you can do about it. So, specifically, I'll be talking about changes you can make in your home and the classroom and resources that are available outside of the home as well. And so, even though I'll be talking about primarily how to identify poor mental health and what to do when that's happening, it's important for us to know that mental health is so much more than when we're struggling. It's something we all have, we work on every single day. When we've had a stressful day and we decided to take a bubble bath or go for a walk because those things make you feel better, that's mental health. When we lose someone close to us and we're grieving, that's mental health. Even when everything's going well, that's mental health too. And whether or not we're mentally healthy actually depends a lot on how we feel about our own mental health. And so when I say this, I mean that mental health is very individual and it looks different for each person. This is important to keep in mind when we have a child or someone in our life, that says they're struggling and we don't understand why. We don't understand why they're reacting kind of the way they are compared to the struggles. But remember, we're all individual. So if someone thinks or says they're struggling, we have to respect those feelings. That is really just the minimum step to being caring and compassionate for people struggling with their mental health. And a great definition of mental health comes from the World Health Organization. And this is one of my favorite definitions because I think it's very inclusive. And it says that someone is mentally healthy when they achieve a state of well being in which someone realizes their own abilities, can cope with the normal stressors of life, can work productively, and can make contributions to their community. So, this is kind of the ideal version of mental health, and it's something we should always be working for, not only for ourselves, but kind of supporting the people that we care about as well. half of people will have a mental health diagnosis at some point in their lives. These are things like depression, anxiety, bipolar disorder, schizophrenia, and this number doesn't include the number of people who will struggle with their mental health, which, to be frank, is all of us. We're all going to struggle with our mental health at some point. We may not have a diagnosis, but we'll definitely have our low points. We'll all have problems in our life that challenge our ability to feel confident and happy. How we address and cope with those problems really shows the strength of our mental health, because our mental health isn't an on off switch, it's more like a thermometer. And there are different degrees of health and mental health. And even people with mental health conditions can be mentally healthy, especially if they're getting the help they need and they learn how to address their symptoms in healthy ways. But mental health conditions are very common. Half of us will have a mental health condition in our lifetime, and 1 in 5 have a condition every year. And the main difference between those is that some mental health conditions are lifelong, and some are they last only for a period of time, whether that be a few months or a few years. Mainly with depression, a lot of people experience episodes of depression that can last up to a couple years, but then they may never experience an episode of depression ever again. But these stats apply to both adults and our youth. And I will say, generally, the older someone gets, the more likely they are to have a mental health condition. And the severity of mental health conditions does vary person by person, but the majority fall into mild or moderate expression of symptoms, with about 5% of the population having what's known as serious mental illnesses, which are basically mental, behavioral, emotional disorders that result in serious functional impairment that substantially interfere with or limit one or more major life activities. So, when most people think about mental health conditions, especially if they don't have a lot of background or history in it, they tend to think more of the serious mental illness. They think of someone walking down the street, talking to themselves, someone who has trouble maintaining a job, X, Y, or Z. But a majority of people with mental health conditions, in fact, do quite well. And the mental health needs of our young people have been increasing over the years. Rates of depression, anxiety, and suicide are all up. And there are lots of different reasons why people say rates are up. Um, but I don't like getting into the why, because ultimately the why doesn't matter. What we really need to focus on is the fact that we've got a large percentage of our kids who are hurting. And what can we do to take away some of that hurt? What can we do to support them while they're hurting? So, when we're trying to get a firm grasp on the mental health needs of our kids, I find a great starting place is the Youth Risk Behavior Survey. And I think it's great because it's a self reported survey, it's anonymous. It's done every couple years in Tennessee. And basically, what they do is they ask kids questions on certain behaviors that put them at risk. So they'll ask them questions about, do you wear a seatbelt? When you ride a bicycle, do you wear a helmet? But also on this survey are questions about depression or questions about suicidal behavior. And when we look at this survey, basically, if you take a classroom and your average classroom is 30 students, there are going to be about 30% who meet the clinical symptoms of depression or other mental health condition within the year, 5 to 6 who have contemplated suicide, 5 to 6 students, and 4 to 5 students who have planned suicide, and 3 to 4 who have attempted suicide in the last year. So I think that's pretty significant. Even though youth suicide rates tend to be lower than other groups, I think youth suicide is really devastating because we always think about what ifs with kids. They have a potential long, long life ahead of them, and we think, what made them do this? So the fact that 3 or 4 in an average classroom have attempted suicide, that's kind of heart wrenching. And so it's important to never think, not my kid, or when you're a teacher, think, not this student, that, oh, they're okay. Because that can prevent us from being able to recognize when a child is struggling. And mental health issues affect kids of all age. Half of all lifetime cases begin by age 14, 75% will develop by age 24, and the age of onset varies based on type of diagnosis. So, anxiety disorders, the average age of symptom onset is 6 years old. So, that's really, really young. And anxiety actually is the most common diagnosis for children and adolescents across all ages. And then upwards, we have behavior disorders, which the average age of onset for those is 11 years old. And that includes things like ADHD, oppositional defiant disorder, and conduct disorder. Um, and then we have mood disorders. The average age for those are 13 years old, and those include depression and bipolar disorder. Which, by the way, today is World Bipolar Day. So it's a great day to spread some awareness on bipolar disorder. And then lastly, we have substance use disorders, which the average age of onset for those is 15 years old. So prevalence does increase as children get older, but mental health is an issue that we need to pay attention to at every single age. Another area of mental health that's getting a lot of attention right now is how the pandemic is affecting our community's mental health. And, there's a lot of back and forth at first on, is it affecting mental health? Is it not? And I think we know at this point that the pandemic has affected our mental health. It's probably affected your mental health. It's definitely affected our kids' mental health. Um, in some way. And a lot of negative things have come along with the pandemic, instability of routine. A lot of people have lost jobs or income. We've got isolation. People are afraid of getting sick, and people have lost people close to them. Those are all very devastating. But luckily, we have some data now kind of to back it up. So in Tennessee, there's a system known as Essence. And basically, this system captures information from emergency departments and basically sends alerts when the number of youth visiting emergency departments for suicide related reasons is higher than it was the previous year. So there are 95 counties in Tennessee. And in 2020, 78 of those 95 counties received at least one alert. So there was at least 1 week where the number of visits to ERs by youth for suicide related reasons were higher than the year before. And so Knox County received 16 alerts in 2020, and East Tennessee received 10. And that's pretty much all of the counties surrounding Knox County. There's also been a notable increase in mobile crisis calls in our area. So McNabb from 2019 to 2020 saw an increase of 1,500 calls, which is really significant. But there is no evidence that suicide deaths are increasing. And unfortunately, we won't have all this information for at least a year or two. But with any data, it's important to not necessarily always take it at face value. The number of alerts could be increasing because parents are spending more time with their kids and they're noticing these behaviors and they're intervening. Whereas it could be, in 2019, pre-pandemic, these kids would be struggling, but no one would necessarily be noticing. And rates could have been increasing regardless of the pandemic. Um, So we don't know for sure why these rates are increasing. We just know that they're increasing, and I think it's probably highly likely that the pandemic has something to do with it. But it's also important we need to look at risk and protective factors, because once we know what puts our children at risk and what protects them, we can be preemptive. We can intervene earlier. So as a parent, it means taking your child to see a therapist if they have a number of these risk factors, or if you're a teacher, making sure to put in place reasonable accommodations to make sure your students feel safe and supported. Mental health conditions are at their root medical conditions, but they're a little bit tricky because it's not as simple as drawing blood and running a test. Oh, you have depression. Instead, we have to rely a lot on self-reports and people reporting their symptoms and figuring it out from there. But mental health conditions, they live in the brain, and whether or not we develop a mental health condition usually depends on two factors: our genetics and the environment we grow up in. So when you're a parent, you have control over a lot of the risk factors a child is exposed to. As a teacher, you definitely play a role as well. whether you're creating a supportive or harmful environment. And it's very important to be hypercritical of ourselves to ensure we're creating as supportive an environment as possible. So, this means looking at our own histories of mental health problems and the traumas we've experienced and how those could be affecting the spaces we create in our own home or in our classroom. No one likes to admit their faults and shortcomings, but if we do, we have a good foundation of knowledge to best know the issues the children we work with may be facing. And it does no one any good to be in denial. So, first and foremost, if a child has a parent or relative that has a mental health condition, whether it's something they're dealing with or have dealt with in the past, a child's risk increases. So, in my own life, I only found out a couple of years ago that my father has bipolar disorder. Had I known that, and it would have been nice to know that, I would have known I'm at a higher risk for depression. I'm at a higher risk for anxiety. I'm at a higher risk for bipolar disorder. And I could have intervened earlier in my own life or made proactive steps to make sure I didn't necessarily go down that path, which I have my own diagnosis, which knowing that now, it's no surprise. And then there are other life situations known as ACEs or adverse childhood experiences, and these can increase a child's risk as well. The more of these a child has, the higher risk they have of not only having mental health issues, but it increases their suicide risk, decreases their overall life expectancy, increases the chance that they won't, complete their high school degree. Um, and ACEs include events like abuse, neglect, other types of household dysfunction, such as domestic violence, incarceration of a relative, divorce, or substance abuse. And trauma can go beyond this as well. Trauma can also include things that happen outside the home, such as natural disasters and bullying. And trauma basically triggers someone's stress response in their brain. And if those chemicals just keep pummeling the brain, then basically it creates a really unhealthy environment for the brain and the body and can lead someone to form really unhealthy coping strategies. And those can become habits and they can almost become addictive, those behaviors they do to make themselves feel better. And childhood is such a critical time for brain development, and luckily the brain is very plastic, so those unhealthy patterns can be set, but they can be broken a lot easier during childhood as well. So it's important to address those root causes as soon as we can. And it can be a little disheartening looking at risk factors. We wonder if there's anything we can do to protect children because not every ACE we have control over. For example, domestic violence. Someone who's never been in a domestic violence situation, they say to someone, just leave. It's as simple as just leaving, but it's not that simple. Um, someone may leave a home and then go straight into homelessness. Do they want to subject their child to that? Um, and so it's important to be self-aware, work on the things that we can to improve a child's safety, but give yourself grace and realize you've probably experienced your own trauma. And these traumas can make it harder to be the type of person, parent, teacher you want to be. And there are definitely times where we can't remove our child's exposure to trauma, but we can build up their resilience. So, resilience is someone's capability to withstand future stress and catastrophe. If we're looking at a child's mental health like a foundation, trauma puts cracks in that foundation. But resilience is kind of like adding extra beams and supports, kind of spackling the walls. It doesn't fix the cracks, right? But it does mean we're making sure the foundation won't come tumbling down. So, some things that can help build a child's resilience include having close personal relationships with family and friends. And you can't control what type of relationships they build, but your relationship with a child, you can make sure it's as healthy as possible. If they have a positive view of themselves, that's very helpful as well, which again, you can't do for them, but you can make sure they feel loved and give them compliments. It means a lot to a child to be complimented by a parent or a teacher. The ability to manage strong feelings and impulses, having good problem solving skills, having good communication skills, feeling in control, being able to find positive meaning despite those traumatic circumstances. And, a lot of these, like I said, you can't necessarily build for them. It's kind of like you can lead a horse to water, but you can't make them drink. But you can assist in the learning process by modeling these behaviors in yourself as much as possible, or trying to teach them skills like how to solve problems, how to talk to people, how to cope in healthy ways. So, if you have a younger child, it's very likely that they haven't necessarily started exhibiting these symptoms. But for especially like middle and high school students, it's incredibly likely that if they have a mental health condition or if they will have a mental health condition, they've already begun exhibiting symptoms. Symptoms of mental health conditions are not occasional things. And if you notice someone exhibiting signs for almost every day for 2 weeks or more, that's when it's time to step in with some active intervention. So, here are a couple warning signs that can indicate that a child is struggling. So, there are physical warning signs and emotional and behavioral warning signs. So, physical warning signs are the things you can physically observe and generally relate to a child's physical health. So, first, if they have change in eating habits, either eating too much or too little. And with eating, especially pay attention to an obsession to eat healthy or lose weight or dieting. Just because someone is at face value getting healthy, it doesn't mean the reasoning behind it is. So, pay attention to that as well. If a child is having sleep disturbances, that can mean sleeping too much or too little, or not being able to fall asleep or stay asleep, or if they have new or persistent nightmares, especially after a trauma, if they seem fatigued or tired and there's no explanation. Um, Reports of aches and pains, especially new things that are going on. It can include headaches, migraines, stomach pain, especially for kids with anxiety. Stomach pain is a frequent complaint, feeling like they're going to throw up, or other physical symptoms without the presence of a physical illness. And physical complaints related to mental health concerns do tend to be more vague than physical health conditions. So that's kind of another way to tell. And there are also emotional or behavioral signs to be on the lookout for. So, if a child has become more aggressive, stubborn, hostile, or prone to outbursts, also pay attention to grades. A sudden shift up or down can indicate a change in their mental status. For example, when I started struggling when I was in college, I went from being an A minus student to taking one summer class that I just about failed. And I didn't realize it at the time, but I was depressed. So that was an indication. If someone is losing interest in activities, they may completely stop doing something or keep doing it, but it doesn't seem like they enjoy it quite as much as they used to. Um, a child who shows difficulty concentrating or focusing, maybe they start avoiding certain places or people, or just avoidance of people in general. If they start showing behaviors that they haven't exhibited in a while, especially behaviors present at younger age. For example, if a kid starts wetting the bed or starts sucking their thumb. May also be changes in physical appearance. For example, if someone stops showering or bathing themselves, or even kind of starts excessively grooming, that could be an indication something's going on. And changes in appearance can also include a change in the type of clothing kids wear. Pay attention to the parts of their bodies that they always keep covered, as it can indicate self harming behaviors such as cutting. Um, New or more intense use of a substance to cope. It doesn't just have to include illegal substances, it can include caffeine, nicotine, or even those that have been prescribed by a doctor. Other risk taking behaviors, if they start isolating themselves, if it seems like they're more restless, if they have new or recurrent fears, if it seems like they're sad or crying all the time. If you do notice signs of self harming behaviors, um, you may not actually always be able to see self harming behaviors. It's a myth that people always harm on their wrists and their arms. Kids are a lot smarter than we give them credit for. So they're going to be more likely to harm on parts of their bodies that can be easily hidden so they don't have to explain. For example, my sister self harmed for 3 years. She was a chronic self harmer. And the fact that no one noticed it for 3 years is a testament to how smart she was about covering it up and being very strategic. Um, so it's actually more common for kids to self-harm on their stomachs, the top of their thighs, and their shoulders. So pay attention to if you notice razors have gone missing, if certain parts of their bodies are always covered, if they spend more time alone. So that means taking bathroom breaks for a long time, spending a lot of time in their room with the door closed. It could definitely mean they're self-harming, especially if they're exhibiting some of the other symptoms on this list. And lastly, if someone starts talking about death or dying and starts making, vague or specific suicide threats, if they're experiencing mental distress, then it's really important to intervene as soon as possible. You don't want to wait the 2 weeks. If on day one someone says, I'm suicidal, you know, you don't want to wait to see if they're really suicidal. So, thinking at these symptoms, you may think, I think this describes a kid I know, my kid. Um, it's possible that what you're observing is a sign of teen angst or growing pains. So there are a few things you can look at to kind of tell the difference between, okay, I need to step in because this could be a mental illness, or it's probably just those growing pains. So there are three factors to pay attention to: intensity. So basically, how intense the symptoms are. Because if they're more intense, it's likely a mental health condition. If they're less intense, it's probably just teen angst. So if the symptoms come and go, then it's probably just teen angst. If they're more persistent, then it's likely a mental health condition. If they're mild but chronic, that could mean it's a mental health condition as well. If they're so disruptive that your child doesn't want to get out of bed, if they're engaging in self harm or having suicidal thoughts, those are all signs that it's a mental illness. The second point is duration. Basically, how long do the symptoms last? Does the child's moodiness come and go? Is it gone suddenly? Is it followed by many days of calm and normalcy? Then that's probably just teen angst. But if the moodiness is more chronic and lasts for longer periods of time without breaks, there's probably something bigger at play. And the last thing you want to look at is domains. Mental health conditions affect someone every single part of their life. So it's pervasive. It's not just going to be present at home or school, it's going to be present in their social life as well. So, on this point, it's really important for parents and teachers to communicate, especially if you want to figure out if a child is acting a certain way in every part of their life. So, don't be afraid to talk to each other. So, if you're noticing any signs of a mental health condition, basically the sooner you can get a child help, the better. Unfortunately, most people do wait too long to get help. The average length of time between first symptom and the time someone gets help is 10 years. So, a lot of these people, as adults who are getting help, they started experiencing those symptoms in those younger years. And sometimes this is because no one recognized they were struggling. Sometimes the child themselves didn't even realize it was an issue. But regardless, the longer we wait, the more severe those symptoms can get and the bigger problems they can cause in the long run. So, intervention for teachers generally means having conversations with the student and looping in the school's counselor to begin having discussion with the student's parent, because you as a teacher, you can't make a child go to therapy. But as a parent, it means generally taking your child to receive professional treatment. And ultimately, parents can make a child's healthcare decision for them, but outcomes tend to be a lot better if someone's a willing participant. So I do not recommend forcing someone to receive psychiatric treatment without their consent unless you've exhausted all options first. The best intervention for pretty much anyone that's struggling is by actively engaging and having conversations ahead of time. to help prevent some of these things by making sure conversations about mental health are normalized, kind of trying to create a space where people can talk about mental health. So, first and foremost, it's important to model sharing about your emotions and challenges positively. Show a child that it's okay to talk about your feelings. Be open and honest about how you're dealing with your feelings and emotions, and it makes them more likely to open up, even if it means being vulnerable, self deprecating, or even prideful about what you accomplished during the day. Um, what I do as a job primarily is I coordinate a youth education program. And so we go into schools a lot. And there's one particular school in Sevier County that has a really wonderful and great school counselor. And I was in a classroom with him a couple of weeks ago, and he was talking to his students about his relationship with his own children. And he was like, one of my daughters, I have a great relationship. We talk with every day. And the other one, he was like, to be honest, like she hates my guts. We don't have the greatest relationship. And you could tell his students just kind of in that moment saw him as a human. And little things like that can help create those spaces and those bridges for students and kids to feel comfortable talking to someone when they're struggling. Second, if you have a mental health condition, if you struggle with your mental health, please don't be afraid to disclose it. If you're a teacher, I definitely wouldn't recommend giving all the nitty gritty details, but you can disclose it. Um, but as a parent, it's definitely okay to show those things. It's okay to show vulnerability and still maintain your role as a parent. If you take medication or see a therapist, even if you do yoga or take baths to calm down, talk about those things. Kids notice what the adults are doing in their life. You know, they notice when you're struggling. They can see those things. And when you're silent on it, it almost sends a stronger message, the message that mental health is something to be secretive about. It's not something that should be talked about. Ask questions when nothing is wrong. Ask a child questions every single day and use open ended questions that are specific. So instead of asking questions like, how was your day today? And the answer is, okay, fine. Instead ask, what was your favorite part of today? Or what was something that was difficult for you today? And if you're a teacher, you can even create assignments to get insight into children's mental health and well being. It can include writing prompts about how they're feeling, what's going on. Um, and things like this can help you recognize when a kid is struggling, especially when there's not really any outward signs that you can observe if you don't have a lot of repeated contact with them. But it's also important. Another one of the preventative things we can do is setting healthy boundaries, helping our kids set healthy boundaries, um, and setting those boundaries for ourselves. Because boundaries protect our mental health from being negatively impacted by the actions of other people. This means saying no to hanging out with people when we're feeling stressed or overwhelmed. It means having those moments where we're entitled to our own privacy. And this is especially important for children. It's important that they have their own space where they can be private and they can be themselves. And there are other things we can integrate into daily life that are good for everyone's mental health. They set up everyone for success. Um, Parents have a direct role in making sure these things happen, teachers, not so much. But regardless, we should be building these skills for ourselves because the healthier we are, those skills and those practices will rub off on the children that are around us. First and foremost, don't underestimate the importance of a good night's sleep, having a good diet, getting regular exercise. Making these a priority can immediately improve your well-being and a child's well-being. I'll tell you, when I'm having a rough day, I know first thing I can do is just prioritize my sleep. Make sure I get 7, 8 hours a night. It makes a world of difference. Second, create a consistent routine. For families, this can mean having an afternoon schedule of sports or extracurriculars, dinner, homework, and some free time. It can also include having a set bedtime, and you can create kind of a similar structure in the classroom. And for everyone, but especially for those that struggle with their mental health, routine is very comforting. You know what to expect, and you know that nothing scary is kind of coming. And it's also important to have rules in a home or a classroom that everyone abides by. So, in a classroom, these rules can specifically pertain to mental health. So, it's a good idea at the beginning of the year to sit down with your students and, have come up with some rules that say, it's safe to express your thoughts and emotions. Like, don't interrupt when someone's talking. Make sure you have repercussions when someone breaks that rule. Make sure people have their space to feel like they can share their emotions. Another thing we can do to prevent mental health issues is by creating a sense of belonging. Remind kids that they're important and they're valued. Compliment them for things that other people don't notice. I mean, I still remember a compliment that my high school teacher wrote on my paper once. She wrote that it was college level writing. And the fact that I still remember that 15 years later kind of shows how we hold those things with us and how much they mean to us. So you may compliment a child for their creativity, maybe their thought process, or even a small gesture they do for someone. In your home, plan intentional time together. Spending time with kids without distraction of screens or other responsibilities can help build a relation can help build a trusting relationship and can help you recognize when they're exhibiting some of those signs and symptoms. I was talking to Laura before everyone else joined in, and I said one of the pluses of this pandemic is families have been spending more time together. So they're noticing their kids are struggling. They're noticing when they're doing well. Continue to create those spaces in your home, and for teachers, create those spaces in your classroom where people can get to know each other and they feel connected. Isolation and loneliness is a big problem. um, Coming together to learn new skills as mindfulness can help as well. Basically, we want to create spaces where kids can feel safe, supported, and heard. And lastly, we want to work to promote those resilience. So build those skills that we talked about. Continue to be open with kind of how you deal with things as well, because the more open you are, the more people feel like they can relate to you, and the more likely they will be to talk to you when they're struggling. But another thing I want to talk about is loneliness and isolation. So it's really important to address any loneliness and isolation kids are feeling. Um, it seems to be a big issue now, and there's not a one size fits all answer to loneliness, because loneliness is a very personal experience, because you can be surrounded by people and still feel lonely. I think we've all probably felt that at some point, right? um, and kids that feel this way for that persistent amount of time, they usually do have something bigger than going on than just not having that meaningful social connection. Usually it means they're dealing with something bigger. So there are a few things we can do to address these feelings of loneliness. First and foremost, making sure they have peer interaction without adult supervision, as scary as this can be, because we want to make sure our kids aren't exposed to anything negative, but we have to give them that space to grow. If they're learning virtually or they're kind of disconnected, switch things up and have them write a letter or make a phone call. Find ways for them to connect. One of the ways my team is connecting with each other is we have a weekly prompt, and we'll share things like, what was your favorite children's book, or what is your favorite song for this week? And it helps us feel connected. And another way of addressing those feelings of distress is just by giving back. There are always nonprofits looking for volunteers. There are local soup kitchens, community gardens, and animal shelters. I volunteer as a foster parent for a couple different organizations. And it's just a great way to foster that independence and responsibility in kids. Because building our home, classroom, or whatever space we have into a place that's more mentally health friendly is something that benefits the children, but it benefits us too. We need that space where we can share about our emotions it's hard for us to sometimes keep that compartmentalization up. So chances are our children will deal with some type of distress in their lifetime. And our hope is that we've created a type of environment where they feel comfortable talking to us. But this may not always happen. As someone who has struggled with their mental health, it can make you have these negative thoughts and beliefs. It can basically, it's a liar. It can make you fear that nothing you do can make it better. So, what's the point? That people won't take you seriously or that people will judge you because of it. And all of these assumptions and lies, basically. And well, sometimes they're not lies. Sometimes people do judge because of mental illness. But it can lead people to mask or pretend like they're fine, to close themselves off. So that means sometimes we have to start the conversations ourselves. And it's really important to start these conversations because even if it doesn't go well, they can have a great impact on kids. Sometimes kids just need to know they're seen and that they're heard, and they need to know that what they're dealing with is being noticed. And the words you use are very important. Choosing the wrong words can leave a child feeling shut down, stigmatized, but it is kind of hard to know exactly the right words, and that's okay. Um, but something you can control is the intention with which you approach the conversation. Always start from a non judgmental and caring place. The two words I always use is I care and I'm concerned. Care and concern. Um, don't ever make any assumptions about how they're feeling. And always try to be hopeful because when someone's struggling with their mental health, a lot of times they have a hard time just kind of seeing that light at the end of the tunnel. So start with little things to set conversations up for success. Make sure you're not preoccupied or multitasking. Make sure the child's getting all of the attention. Keep eye contact and make sure you're really listening, not only to their words, but to their body language. Especially pay attention to hands and how they're moving their legs, like if they're tapping, if they're twitching. Start by telling a child that you've noticed something different in their behavior, that you care and you're concerned. Don't label the process and bring up anxiety, depression, or another mental health condition because it can leave them feeling labeled and confrontational. A good conversation starter is I've noticed X, Y, and Z. What's going on? So that could be, hey, I've noticed you've gotten a couple C's on your papers lately. What's going on? Or I noticed you've been sleeping longer. What's that about? And remember to ask open ended questions that require more than just a yes or no answer. Otherwise, the kid might shut down. Recognize that the conversation may be uncomfortable, and that's okay. Um, some of us don't like having these conversations. Our kids may not like having the conversations. It can leave us feeling kind of awkward and vulnerable. They may feel defensive or defiant. But ultimately, having these uncomfortable conversations is really important. Don't expect an immediate connection. Even in the past, if you've had a really good relationship, just remember to keep being persistent, don't give up, and keep paying attention. And it's okay if your child doesn't want to talk to you. If they're not comfortable talking to you, ask them if they'd rather talk with someone else. This can open up the door to have your child willingly see a therapist or seeking some other type of outside help. I cannot tell you how many times I've come into contact with a child through my work and they've told me, hey, I want to get help, but I don't know how to have this conversation with my parent. Or I've tried to have the conversation with my parent and they've said, no, I'm not going to do that. So when just by being here, you show that you really care about kids. So I'm hopeful that none of you would kind of react in that way, but it's important to have these conversations and reach out when you notice something being an issue. There are certain things that you do want to avoid saying. Typically, someone with a mental health condition feels very alone, feels like they did something wrong. Maybe they're in pain, they can't figure out why. Um, and so, language that is punishing or patronizing can reinforce this message. So, some examples of patronizing or punishing language include, you're so smart. How did you let this happen to you? What did you do to get depressed? Kind of putting the blame on them. Or even saying, I understand. I was depressed one time. Unless you were clinically depressed, don't ever assume you know what they're feeling. But even if you were depressed, saying something like, I've been depressed before, but that doesn't mean I understand how you're feeling. Seeing even saying calm down or oh, you finally got out of bed. I always say avoid using the word finally. It's probably the word you should avoid all the time because it definitely has a certain connotation. Being called dramatic or doing it for attention can also add fuel to the fire and make someone feel more cut off from seeking help or opening up. It's not fair to punish someone for suffering. We want to create environments where they feel comfortable talking to us, right? So we don't want to react in a negative way. We also don't want to push our beliefs or assumptions onto the child. Don't try to rationalize what they're going through and tell them they shouldn't feel that way or that things aren't that bad. This reinforces the idea that something is wrong with me. And that will make someone be even more closed off. So, for a child struggling with their mental health, sometimes all they need is changes in their routine, changes in their coping. So, as a teacher, you can make reasonable accommodations. Simple things like allowing beverages in the classroom or extended time to complete assignments, or even having a seat close to the door so they can leave if they're starting to panic. This can be really helpful. Um, but there are times when outside care is 100% needed. Um, because mental health and mental illnesses, they do exist on a spectrum. So the way we approach it is going to be different for each person. So, like I said, children with mild symptoms may be able to manage them through healthy coping and self care. This can include things we've already talked about, like getting a good night's sleep, exercising, having supportive relationships, or even doing mindfulness or journaling. Um, when self care doesn't alleviate symptoms, then the next step is to get the child professional help. So as a teacher, when you're noticing these signs, the next step is to talk to your school's counselor, and they can bridge the gap between the student and the parent. um, and sometimes schools do have even professional mental health counselors on staff, and so that's a great opportunity. It can kind of be a natural gateway to that. If a child is self-harming or suicidal, never start with self-care. Start by removing lethal means from the home, like firearms or medication. Then seek professional care. As a teacher, if you notice this child is self harming or suicidal, be sure to intervene immediately and let your school's counselor know. If they're actively suicidal, meaning they're planning to attempt or have already attempted, for example, I met a child once who told me he was eating apple seeds because he heard they were poisonous and he wanted to die. That is the type of child you don't want to really leave alone. So you have someone else kind of help you get someone in. But if you don't have concerns about suicide or self harm, the next step is to help a child receive professional mental health care. First step is generally to see a doctor or a pediatrician to rule out any physical health conditions, um, because sometimes they can mirror or mimic mental health conditions. But once they've excluded those things, then the next step is usually talking to a counselor or a therapist. When finding a counselor, it's important for the child to be involved in the process as much as possible. It can be helpful if they're old enough to have them do research. In fact, most private practices will make available descriptions for their therapist, so you can figure out if someone's going to be the right fit, because it is very important that a therapist be the right fit for someone. Recognize that therapy is a confidential process, and your child's therapist doesn't need to tell you specifics about what your child's talking about. If they do, it means they're breaking all sorts of ethical guidelines. They can talk to you about changes and things you should make in your home to make the environment more supportive for your child. Um, And something to know about therapy in Tennessee is there is something that's known as the mature minor exception, which basically means for kids 16 and up, children do not need parental approval to seek care, nor can you force them to receive treatment against their wishes. So this exception can be really helpful for kids whose parents are not supportive. It doesn't work out so well in the opposite case where the parent wants their child to get help, but their child is very resistant. And lastly, medication is also commonly recommended as a treatment option. Just do your research, figure out if it's the best choice for you, your child, the family. Advocate for yourself about what you think is going to be best. And if there are any teachers on the call, when a child has started taking a psychiatric medication, that's when I would recommend stepping in with some additional accommodations and being as flexible as possible. The adjustment period is, to be frank, quite uncomfortable. So giving a child leeway can be really important. Recovery from a mental health condition is not one and done. It's an ongoing process. Don't pressure a child to be normal. Learn to accept and appreciate a new normal, because even though mental health conditions absolutely can be debilitating, they can. They don't have to be. How you react to and support a child can make a huge difference in their long term success, because mental health recovery is not simple, it's not straightforward. Don't expect someone to improve immediately, and don't give up if there aren't any changes. Sometimes the therapist isn't the right fit and you need to switch someone else. Sometimes the medication isn't the right fit and you need to switch to something else. Treatment's very individual. It's important to use all the tools you have at your disposal until you find the one that fits best. So to finish up today, I just want to give you a few more resources that you can access to learn more about mental health. And I will send out a resource guide to Miss Roberts so she can send that out to everyone. It includes a lot of this information as well. My favorite website on this list is childmind.org, because they have some great articles about like practical steps for parents when their child has depression, ADHD, anxiety, and some really great, very comprehensive guides. Here are also a few local treatment providers. Included a couple Anderson and a couple Knox places. Um, and so there's Beard and Behavioral Health, the Middle Path, Bridgeview, Healthy Minds, and McNabb Center. Personally, I know people and work with them at every single treatment provider on this list. So if you've tried to work with this provider, a lot of what the Mental Health Association does is kind of advocate for people. So if you had an issue getting your child treatment or receiving appropriate treatment, get in touch with me and I can help grease the wheels on that. And lastly, here is some mobile crisis information. It's always important to have this information handy. Basically, when a child is at risk of hurting themselves or others, I recommend calling mobile crisis, because then they'll have a clinician do an assessment and basically determine best course of action. Um, Call 911 if the child needs immediate medical attention. That's very important. So that means if there's self harm that needs medical attention, there's any sort of substance use where they need detox, or any other medical issues, mobile crisis will usually recommend you receive medical care before they step in with any sort of intervention. And if you are, which I apologize, I forgot to update the number on this, so I'll update it before I send it to Miss Roberts to send out to you all. Um, if you are calling 911, always ask if they can provide a CIT officer. And most officers should be trained at this point. I think it stands for crisis intervention training. And basically, officers who've received this training, they have 40 hours of training of how to deal with a mental health crisis. So they'll be a lot more prepared. So I know I kind of rushed through that, but are there any questions? I appreciate everyone for calling in today.